This segment of Delmarva Life is brought to you by Peninsula Home Care.
We all know COVID-19 created quite a challenge for healthcare workers. For some patients, that challenge can extend into rehabilitation. Getting back to doing simple everyday tasks can take some time and direction from an occupational therapist. Fortunately, that's something Peninsula Home Care can offer in the comfort of your own home. We recently visited a PHC patient to see how OT got her back on her feet and back into life.
Off a little bit, take your time. There you go. Good job.
Susie Klimkowski of Ocean City is back on her feet after COVID knocked her down and out.
One day I woke up and I'm in such pain, it was unreal.
After a week in bed, Susie needed some help.
Well, you have to learn how to get up and do everything all over again.
All right, easy. There you go. She is an amazing lady.
Caitlin Prettyman is an occupational therapy assistant with Peninsula Home Care.
She never gave up. That's one thing about her. Even if she didn't want to do anything, she powered through, pushed through, and getting individuals with COVID and who are weak out of bed is the most important thing.
Caitlin also needed to make sure Susie could get through her normal day-to-day activities.
We focus on, can the patient get out of bed for a while? And she was able to get out of bed. And can she walk to a chair, or do we need to put a chair by the bed so we can just pivot the patient over to the chair? And she was, despite being weak, able to walk to her chair where she was most comfortable.
But the progress didn't stop there.
Out of bed was the beginning for her, and then seeing how long she could stand for. So we would do some standing exercises with her, and then once I saw she was able to stand for longer than 2-3 minutes at a time, then we would practice going to the sink.
They got me up walking.
Good.
They got me, brushing my teeth. That was a big thing, just to get up and brush your teeth.
From there, Caitlin would work
Maybe
with
take
Susie
one,
to get her comfortable
little
with
step
other
back.
daily tasks.
We take the task and break it down. It takes a lot of encouragement for them, and they do get frustrated a lot of times because they've been doing this for so long, their whole life, laundry and dishes. But once we break it down, we'll see what the problem is there any equipment that needs to be used? We take it step by step, and then we go from there.
Susie says she's grateful for the therapy provided by Peninsula Home Care because she says some days she just doesn't know if she would do it herself.
Yeah, oh yeah, they'd come and I'd say, I can't do anything today, I'm having a bad day. And they'd say, okay. And then they just talk me right out of it.
All in the comfort of her own home.
That's the best part. Because even for me to go to the doctors, and my doctor was in Salisbury, and to go to Salisbury, by the time I got there, I was half dead.
I think that doing it in the home is the most functional way, especially for occupational therapy. Because if you're not in the home, then you're trying to simulate how their kitchen looks in a rehab gym, or where steps should be going up into their kitchen. So it's really hard to simulate that. So being in the homes, you can see what the obstacles are, if a furniture needs to be moved, things like that. It makes it a lot easier, and it's the most functional way.
Susie says the therapy worked. She's doing much better.
Walking and talking and thank God. And I'm going out to dinner. Yeah.
I think that's one of the most rewarding things about my job is having a patient who, like Susie, she came home so weak, and one of her hobbies is reading, and she loves her coffee. So getting her strong enough to make a cup of coffee and just seeing how excited she was, that is why I do what I do, is so my patient can be as independent as possible. Another advantage to having Peninsula Home Care for occupational therapy is their collaborative team approach toward care. That means everyone is on the same page.